And in 1924 is when Viceroy reading laid the foundation stone of the hospital. And of course, the founder was Dr. S.P. Shroff.
Okay.
And after his training in Edinburgh, he had first started a clinic in Chandni Chowk in the Dharamshala. And soon he realized that there is such a big need, and he was able to influence the then British government to give this piece of land, about 4.5 acres of land. Luminaries like Mahatma Gandhi, the first president, Dr. Rajendra Prasad, on a financially sustainable model where we do 50% of the work that is done is for the very poor, where the patient is not paying. And we are able to meet our running expenses through what the patients pay who can afford to pay. Cataract has a very simple intervention, as do refractive errors. I mean, all you need is a pair of glasses.
Correct.
So it's a big problem. It's a big problem if you just go outside, say 200 kilometers outside of Delhi.
So does your team suggest the myopic lenses by Essilor?
Sure. I think it's more at the optometry and doctor level that they are suggesting to the parents, departments here. And we were among the first in the country to start pediatric care. And they
हम ट्रांजिशन रिकमेंड करते हैं. ट्रांजिशन में सबसे फास्ट डार्क होता है, जल्दी क्लियर भी हो जाता है, इसको उसका रिकमेंड करते हैं. कई कलर्स आते हैं, अवेलेबिलिटी अच्छी है. और सबसे बड़ी बात है कि एसिलर में फास्ट सर्विस है और कोई भी किसी तरह का इशू हो तो इजीली सॉल्व हो जाता है.
So you came today from Sonipat?
At 1 in the morning, yeah. We have 2 vision centers there.
Achha.
One in Purkhas, which is like a block inside Sonipat,
Okay.
and then one in Sonipat.
One in Sonipat, sir. Okay. This hospital was started in 1926.
Actually, it started, if you can say, in 1922 is when the trust was formed.
Okay.
And in 1924 is when Viceroy reading laid the foundation stone of the hospital.
Okay.
And of course, the founder was Dr. S.P. Shroff.
Okay.
And after his training in Edinburgh, he had first started a clinic in Chandni Chowk in the Dharamshala.
Oh.
And soon he realized that there is such a big need, and he was able to influence the then British government to give this piece of land, about 4.5 acres of land, for an eye hospital. And that must have happened around 1922.
Okay.
24 is when the foundation stone was laid, and in 1927 is the Viceroy Irwin inaugurated this hospital.
Okay.
Lady Irwin.
It's a lady.
Yeah,
Okay.
so she inaugurated the hospital.
Okay.
Soon became very popular, and I think across North India, right from Lahore to Kanpur, this was the main eye hospital. And
During that time, it was so big, or
yeah, it's always been this heritage building that we have today, this colonial building, and it's been pretty much the same structure since that time. And it was developed as an eye hospital. And we've had luminaries like Mahatma Gandhi, the first president, Dr. Rajendra Prasad, C.F. Andrews, who was closely associated with Gandhiji. And then subsequently also, and I think even post-independence, we had the first health minister, Rajkumari Amrit Kaur. All of them used to come here for their eye treatment. So it's had a glorious past, and a lot of people who, of course, they passed their prime now, but they had worked here at some point, most ophthalmologists of any repute. So through, you can say, the 20s to 60s, it was a very popular eye hospital.
I will just go slightly back. I saw it online, prescription of Mahatma Gandhi also.
Yes.
So who was the person who did the eye checkup?
So there used to be a Dr. Mathur.
Mittar.
Okay, Mathur. He was the CMO somewhere in between the 30s and I think right up to maybe something like 1950. And Dr. Mathur was Dr. Gandhiji's doctor.
Okay.
And he
was an eye doctor.
He was an eye doctor.
Okay.
And the history with Dr. Mathur is that subsequently he started a clinic which Dr. Hari Mohan inherited.
Okay.
And so Dr. Hari Mohan's clinic also has a Mathur memorial.
Oh, very interesting. I didn't know that.
Yeah.
Okay.
So it was Dr. Mathur at that time. But Yeah, it has had a history
Great,
behind it.
interesting,
Yeah.
interesting.
But there was a time, say, you can say, it was a pure charity hospital, which
Since
was
beginning itself.
from the beginning. That was the mission of the hospital, and it was dependent on donations for running the hospital. I think somewhere down through the 60s, 70s, 80s, 90s, the hospital wasn't able to financially sustain itself well.
Okay.
And so, and that was the time when a lot of new things were happening in eye care, microscopic surgery, intraocular lenses came, then subsequently lasers and all that was happening. While this hospital was struggling for some time because of the nature of the hospital, which was dependent on donations and pure charity. And so the services kind of declined, and the quality of work as well as the services, the upkeep of the hospital, technology upgrades were not happening. And so it started to degenerate, and the trust was looking out for support. And somewhere in the mid 90s is when the Aisha group, Aisha that makes trucks and Royal Enfield motorcycle, Mr. Lal stepped in to support the hospital. And from a pure charity hospital, we started working on a cross subsidy model.
Okay.
And so a lot of work went into improving the quality of services so that the patients who could pay would also choose to come here. And with that, we continue to do 50% of the work is completely free for the very poor.
Okay.
And so we work on a financially sustainable model where we do 50% of the work that is done is for the very poor, where the patient is not paying. And we are able to meet our running expenses through what the patients pay who can afford to pay. And over a period of time, we improved on our services. We have some of the best doctors here. We are very well known for our subspecialty work in pediatric ophthalmology, corneal transplants, stem cell work, glaucoma, tumors of the eye, retina work. And also we do a lot of training. So we train a lot of young doctors, and then they go and spread the work. With this cross subsidy model, we are able to give very humanitarian, compassionate care where it's most needed. At the same time, we have to remain abreast with what's new, what's latest to attract the patients who can go anywhere. We were among the first eye hospitals to get an NABH certification.
Okay.
Because charity doesn't mean second rate. In fact, when you start doing high volumes, it becomes even more important to have good quality standards. And that rubs off on the non-paying patients as well. There is no difference in the medical treatment safety, whether you're paying or not paying. But there could be small differences of air conditioning, the kind of lens you choose and stuff. But when it comes to safety, there's no compromise whoever you're operating on.
So now, more about you, doctor. Since, if I'm not wrong, you are here from last 30 years.
About 26 years.
About
yes.
26 years. So you had thought to be an eye doctor only, or you wanted to do something else, then accidentally you entered into this?
No, I think ophthalmology was always in my mind because my maternal grandfather and my uncles were ophthalmologists. In fact, coincidentally, my grandfather worked in this hospital in 1930s.
30s. Oh.
30s, and he picked up his ophthalmology skills here. Dr. K.G. Mathur. In fact, he was here when Dr. Mithra, we were just spoke about. He worked with him. And so I'd seen him as an ophthalmologist. So when I got into med school, Yes, there was always this ophthalmology bug in me
Okay.
that I was keen to uh, become an ophthalmologist. Whether I'll be this long in Shroff, I wasn't sure because it was at that stage it was just deciding to come out of its old degenerated state.
Right.
But it was interesting to be part of this whole journey of trying to, bring it back.
Correct.
And then this whole mission of taking care of those in need and make a significant dent in blindness. And North India especially needs a lot of it because this is the hotspot of blindness in the world.
Correct.
And so to be able to make a difference through this institution gives a lot of fulfillment.
Correct. Correct. So again, coming back, you were talking about blindness, and also cataract is one of the things which has been growing at really fast pace in India. So, what do you think is the reason? And I believe the Shroff Hospital is the one which has done maximum cataract surgeries also.
Not the maximum in the country, but yes, we do a significant number of cataracts. So India, it's ironic at one level in India has the most number of blind in the world, and of that 65% of the blindness is because of cataract.
Okay.
But India also has done very well in cataract eradication. We have reduced the prevalence of blindness significantly in the last 20-25 years. And most of it has been done outside the government hospitals, and not-for-profit hospitals have contributed significantly in India in reducing the cataract backlog and blindness overall. The problem is that the population in India is growing. So even if you're reducing the percentage, the numbers still happen to be that large. And you can imagine this problem because India is still a very young country. About 70-75% of the country is still under the age of 40.
Right. Right.
So all of these people in subsequent years will require more eye care services.
Correct.
And so we need to get ready because the need is only going to increase. It's not something that you can sit on. It's a moving target that you have to work for.
But how do you think that the onset of cataract can be delayed? Is there any way? कोई तरीका है कि जिससे cataract मुझे let's say 60 में ना आके 70 में आए?
A good question. We don't have a good answer. India में cataracts do come a decade earlier than the West. So a lot of people in their 5th and 6th decade get cataracts in India.
उसका क्या reason है? What is the reason?
Probably it's to do with nutrition, it may be to do with UV radiation, exposure. It's basically aging of the proteins of the lens.
Okay.
So we are not sure. Part of it could be genetic as well. But Indians do tend to get their cataracts early. And so the burden becomes higher compared to the West. But we don't have a good answer for that. But a cataract has a very simple solution. It's a 10-15 minute surgery and you recover very quickly and you're back with good vision. So cataract has a very simple intervention, as do refractive errors. I mean, all you need is a pair of glasses.
Correct.
So two important causes of vision impairment actually have time-tested, simple solutions.
Right.
There are conditions like glaucoma, for example, which are more complex, where the definition to diagnose, the expertise, and then long-term treatments, and you can at best stop its progression. You can't reverse it. But both cataracts and refractive errors, which account for a large chunk of vision impairments, have simple solutions, but we don't have good access. Everybody doesn't have the same access to those solutions.
Those solutions.
As they say, your PIN code is more important than your genetic code. Where you're born determines how healthy you are.
Interesting quote.
Yeah, because if you're born in a metropolis city, you have better services.
Correct.
You move into the hinterland, and certainly you don't. There are districts without good services.
Since you have hospitals in smaller districts also, तो वहाँ पे भी अभी ये problem है, like getting eyes operated या even normal चश्मा बनाना.
Yeah, it's a big problem. It's a big problem. If you just go outside, say 200 kilometers outside of Delhi,
Okay.
suddenly the situation changes. Where, say, deep down in central UP, where we have some hospitals, whole districts would have 1 or 2 ophthalmologists. Each district of UP is at least 30 to 35 lakh population. So,
For 30-35
lakh population, there will be just maybe 5-6 ophthalmologists, if at all, who are also may not be very productive. So you don't have organized hospitals to take care of the masses. And when you have scarcity, of course, most people at best would take care of the top 5% of the population because
Correct.
they're busy looking after them.
Correct.
But the large populations are left behind.
So you are a cornea specialist.
Yeah.
Right? Also, is it true that करीब 15-20 दिन या महीना लगता है to get an appointment from you for
It's not that bad, but yeah. So cornea, we all know about cataract. Cornea is the transparent layer in front of the black portion of the eye. Corneal blindness is the second leading cause of blindness in India. It accounts for almost 8% of the blindness.
Okay.
And that is because cornea is the exposed surface of the eye, and especially farmers who are working in the fields, they get a brush of, say, a leaf or an animal tail or something that causes an abrasion, which gets infected.
Okay.
And this needs emergency treatment. If you pick it up in time and the right antibiotic or antifungal is instilled, you get a small lesion and you recover from it. But if you don't get appropriate treatment, these ulcers become deep, and if you're lucky that it gets treated with medicines, it leaves a bad scar, and if you allow it to grow further, then you sometimes need a corneal transplant to save the eye. So corneal transplantation is required sometimes as an emergency procedure, and sometimes to improve the vision if you have a scar on the cornea.
Corneal transplant will happen from someone's eyes?
Yeah, so this is the cornea, what most people would know about eye donation.
Yeah.
It is only the cornea that you take out and you transplant. It's not like the whole eyeball.
Okay.
It is only the cornea that gets stitched back.
Okay.
And it is one of the most successful transplants in the body because there are no blood vessels on the cornea, and so in most cases the chances of rejection are lower. Eye donation is something that every individual can contribute to, because in the hour of death oftentimes we forget.
Correct.
But if you can just give a call to the eye bank, the team can come. It takes only 15 minutes. There's no bleeding, there's no disfigurement. It's only the cornea that is removed. And you can give sight to 2 individuals. And anybody from the age of, say, 2 years to 80 years can donate.
2 years to 80 years?
Yeah.
Okay. And is it right, if I am not wrong, that when you joined here in 96, you were the one to start this eye bank?
Yes. So the eye bank started after I joined. Actually, it took some time for registration. So it started only in 2005.
Okay.
So we started, I know, in the first year with just 25 tissues.
Okay.
Today, our eye bank is among the largest eye banks in North India, and we do about 2,000 odd transplants every year.
2,000?
Yeah.
That's a big
So we also give tissues out to surgeons outside of Shroff. And all our satellite hospitals also are transplant centers. So we look after communities there by doing transplants there itself.
Okay, so that would be done at a subsidized price. Or
Yeah, all of it, a lot of it is done at a subsidized price. So you can imagine these farmers who come in emergencies have to be looked after.
Correct,
So almost 50% of our corneal transplants we don't charge at all.
50%.
Yeah, almost, because unfortunately a lot of very poor people
They can't afford it.
need the transplant. I think we all became doctors with a little bit of spark to do something good for people. Somewhere down the line, you know the way things work, you sometimes forget why you were doing this. But in this not-for-profit cross-subsidy model, we don't have to worry whether the person can pay or not. Also, all of our doctors are salaried. We don't get an incentive on any procedure. So you do only what is right for the individual. There is no need to overstretch yourself to do something. You do what is right.
Okay. Yeah. So I think after cataract, myopic is the other thing in last 5-6 years, and especially after COVID, it has started picking up in the way ki, especially in children's and all. So do you also have a myopic center here,
Yep.
and how do you think it can be treated? And if I'm not wrong, I think China is like number one
Yeah.
in terms of number of patients who are really highly
Sure, but
myopic.
it will happen here as well. So yeah, COVID I think has really highlighted the problem, because children, or maybe it's COVID or just internet per se, and the access to mobile devices, uh, that earlier when we were growing up, our parents had to literally call us back home inside because we would be playing outdoors. Now you have to literally throw children out. कि जाके खेलो बाहर, because everybody is so happy sitting with their devices. Now, what has been seen is that children who indulge in near work tend to become myopic. Myopia is also called nearsightedness or short-sightedness, that you can see for near, your vision becomes blurred for distance. And eye is almost like an autofocus camera. So if your world is only this much, it will adapt to that.
Okay.
If your world is outdoors, then it'll adapt to becoming, that the eye can look at infinity. But if this is your world, it'll adapt to that.
Okay.
So because of indulging in a lot of near work, and of course you have to study, so that is near work, but more than that, now entertainment to gaming to everything is becoming on these devices, that we are seeing suddenly that myopia is on the increase, especially in teenagers and young adults. Myopia is increasing because of lack of outdoor exposure, less of sunlight exposure, and being indoors with your devices and books. And so myopia is quite on the rise, and looking at the need, we opened a myopia center, which is specifically looking at it, so the counseling can be done. Even if you are myopic, if you can reduce the progression of myopia, it's useful, because if you're -2 or if you're -10, it's very different. Because as the myopia increases, also the complications of myopia increase. You have a higher risk of retinal detachment, you have a higher risk of macular issues, which is the central part of your vision, can get affected. So the complications of myopia also increase. So if you can reduce the progression, even that is important. And so there are new ways to reduce it. Some are with some drops.
Okay.
But I think these new glasses that have come, which blur the peripheral vision, and that probably reduces the progression of myopia. And so studies are showing good results with that. So you need to also document the progression.
Okay.
So with measuring of axial lengths, checking the corneal diameters. So myopia is generating a lot of interest right now, a lot of studies. And you're right, the Far East, they say in the oriental population of Hong Kong, Taiwan, Singapore, China, in one generation from 30% myopia, it's almost 90% myopia.
Oh. 90%.
So India may not be that high, but we can see that the urban area children are more myopic today, and it is on the rise.
So you have an optical store here. So does your team suggest the myopic lenses by Essilor?
Sure. So I think it's more at the optometry and doctor level.
Okay.
That they are suggesting to the parents and things, because they need to be counseled first, and then the optical shop is looking at that.
So can we go and see your place where you also work?
Sure.
And the optical store also?
Sure. So here on the first floor we have the ward. I was telling you we work on a cross-subsidy model. So this is where patients who pay for their service would come and get operated. Most of the surgeries are daycare, so they stay just for a few hours and then they are discharged. So then we have a general ward. We can walk up there. So both cataracts and subspecialty patients would stay. Some of them would stay a little longer. And then we do a lot of pediatric work. So we treat tumors of the eye. Then there are premature children who retinopathy of prematurity. So they get they are screened in neonatology NICUs and Delhi government hospitals, and those who require lasers are brought here.
Okay.
So a lot of these children after surgery would come here. Good afternoon. And
so just out of curiosity, I want to know, I'm sure doing operating an eye of a 30-40-year-old person would be easier than going for
of course, it's children. We have one of the best pediatric, departments here, and we were among the first in the country to start pediatric care. And they require specialized doctors because the eyes of a child is very different from a regular eye. So this कोई बच्चे हैं?
नहीं अभी छुट्टी हो गई सर.
अच्छा छुट्टी हो गई. Okay, we don't have. That's good. Yeah. So there are children. There is a cancer called retinoblastoma, which occurs only in children and can be in families. So they need early intervention, but it can be salvaged. Not just the life, even the eye can be salvaged if detected in time. But in India, this expertise is not available, and so patients come very late. So we do chemotherapy and even
chemotherapy is done here.
Yeah. And also the surgical work on them is done here.
So all these kind of treatments also are part of your charitable stuff?
In fact, most of it is, for some reason, these tumors are in the very poor. And so it's expensive treatment. Each child we spend a few lakhs. But we are fortunate there are people who support some of that treatment. So, but yeah, most of it is done free. I would say almost 75% of it, the patient isn't paying anything.
Okay.
So downstairs is where the outpatient clinics are, and where we see. So I'll show you some of these donors that we have here. So
अच्छा ये
Yeah, if you see the donors over here who have been giving, and एक second थोड़ा side में हो जाएंगे. If you see, the Countess of Reading was the viceroy's wife, who had laid the foundation stone. That's the foundation stone there. And Nizam of Hyderabad as well.
oh
Ratan Tata.
very nice.
And so that's the foundation stone. See, 1924. So we are that way celebrating a centenary this year.
Oh अच्छा हाँ.
So this is where the patients come into, and we have, the patients get registered, and so they get registered. Everybody across the network, even in our peripheral hospitals in UP, Alwar, are registered on this electronic medical record. So we can seamlessly, see what work has been done there, and if a patient is referred from a peripheral hospital. You are asking where I see my patients, so So these are clinics where, the patient doesn't move. So the patient's refraction, pressure checks, slit lamp examination, indirect, all of that gets done here.
Okay.
And otherwise the patient has to move from one place to the other. So here you come into the room, we'll complete your examination. Of course, I have optometrists who will do the initial workup.
Okay.
And then I would come in. So when I'm in the clinic, I would have 4-5 rooms to myself, and I keep moving while the patient stays in one room.
Okay. How many centers you have outside?
We have, outside of this, we have 8 more centers. So in Vrindavan, Meerut, Modi Nagar, Saharanpur, Shahjahanpur, Alwar. So we spread in these locations. A couple of more may start in the next 1 to 2.
Let me see your optical shop.
The optical, in fact, the other one is better. Let's go there.
The other one. So वो ये वाला पुराना है. That's the new one.
इसको अभी upgrade करना है. अच्छा, actually, this pharmacy and everything has to move. We are upgrading. The myopia center is upstairs.
Okay. अच्छा, that's what.
So we're creating some new clinics. Along with that, we'll upgrade this whole opticals.
Okay.
So in another 6 months.
So how important you feel is optical for you in this whole eye surgery setup and all OPD?
It's important because I think refractive error constitutes a significant part of visual impairment. So you are very incomplete if you don't take care of the whole refractive error business. And the problem even with spectacles is the same. I mean, if you don't have it at the right price point, patient will not afford it.
Okay.
So you have to again look at both access, cost effectiveness, and also spectacles, opticals as a business helps in the cross subsidy model.
Okay.
Because if you run it well, there are reasonable profit margins in it, and which should overall help the whole ecosystem.
Okay.
But it's a complex business. It's not, because
Especially for an eye hospital, I can understand.
Yeah, it's complex because there are variations in the lenses, frames. It's a fashion accessory at one level.
Managing the inventory, so many powers
And to be able to cater to all the different segments of the society. We do have a lot of children coming and concerned parents. So of course they are slightly at the expensive price point right now, but for those who can afford it, it is something that is giving good results.
Okay.
मैक्सिमम तो एसिलोर का लेंस हम बेचते हैं, क्योंकि एसिलोर वर्ल्ड की नंबर 1 कंपनी है, बेस्ट प्रोडक्ट है और पेशेंट की सेटिस्फेक्शन को ज़्यादा है उसमें, पेशेंट डिमांड भी करता है आकर के एसिलोर के लिए, ठीक है ना। तो हम एसिलोर की हमारी फर्स्ट प्रायोरिटी एसिलोर होती है। एसिलोर में जैसे अगर सिंगल विजन की बात करें तो हमारे जैसे क्रिजाल है, क्रिजाल रॉक है, ये देते हैं। और प्रोग्रेसिव में तो देखिए वेरिलेक्स जिनका सबसे बेस्ट लेंस है, कंपनी ने इनोवेट भी किया है एसिलोर ने प्रोग्रेसिव को। तो इसमें जो वेरिलेक्स रेंज है, तो क्योंकि यहाँ पे हमारे जो हॉस्पिटल है वो चैरिटी हॉस्पिटल का एक नाम लगा हुआ है, जिसकी वजह से थोड़ा प्राइस सेंसिटिव रहता है, तो इसलिए हम प्रोग्रेसिव में तो जो वेरिलेक्स में लिबर्टी और कंफर्ट थोड़ा कम रहता है, बट एसेंशियल जो है इनकी वो हमारे यहाँ ज़्यादा सेल होती है।
हॉस्पिटल है तो यहाँ लोग आके पूछते होंगे कि हमें यूवी से बचने के लिए क्या करना है?
बिल्कुल बिल्कुल पूछते हैं, तो हम उसके लिए हम ट्रांजिशन रिकमेंड करते हैं। ट्रांजिशन में सबसे फास्ट डार्क होता है, जल्दी क्लियर भी हो जाता है, इसको उसको रिकमेंड करते हैं। कई कलर्स उसमें आते हैं, अवेलेबिलिटी उसमें अच्छी है। और सबसे बड़ी बात है कि एसिलोर की फास्ट सर्विस है और कोई भी किसी तरह का इशू है तो इजीली सॉल्व हो जाता है प्रॉब्लम।
आज के डेट में मायोपिक के बारे में बड़ी चर्चा
बहुत, हाँ जी, हाँ जी, हम बिल्कुल आते हैं। हम स्टेलिस्ट लेंस को हम रिकमेंड करते हैं, क्योंकि उसमें हार्ड टेक्नोलॉजी का इस्तेमाल किया हुआ है, तो मैक्सिमम हम उसको स्टेलिस्ट ही सेल करते हैं।
We see this whole range of patients at the hospital. So you have a lot of rickshawalas and things who come to in the private side. Then there'll be patients who will opt for the more expensive, progressive classes as well. So we're trying to cater to all, but it's not the easiest thing to do.
Right. Good. Can we see the pediatric also?
Yeah, sure.
Because I don't think anyone has such a big setup for just for pediatric.
Yeah.
So normally what time you start?
The registration starts at 7 a.m.
7 a.m.
Yeah.
Oh.
And the clinic workup starts happening at 7:30 in the morning.
7:30.
Yeah, patients line up sometimes even earlier.
Oh.
So
Okay.
So we start. The doctors are in their clinics by 8:30.
Okay. And शाम को क्या होता है last OPD?
Last OPD, some stretch. The last appointment is till 5 p.m.
Okay.
But also there is a bit of a summer, winter variation that happens. This is specifically for children. Hello. So the clinics are designed to get look after children.
You do vision therapy and all.
Vision therapy. Now a lot of it is upstairs.
Okay. Yeah, so again, this is also a new part.
This is a new thing, myopia center and vision therapy and early intervention for children. Okay. So sometimes children are born with cerebral palsies and things, and they need a lot of stimulation to get their eyes to function.
Okay.
So the earlier you intervene, the better the Good evening.
You like very new.
This is pretty new. Just a few months old. So here you can see. Hello. This is what kind of a patient are you seeing? First visit.
किस चीज का पेशेंट?
Squint. Yeah. What do you do here?
surgery and who patients who don't require any surgery.
So you do exercises. The eye or the brain hasn't developed completely, so they need early intervention to stimulate their retina.
But then यहाँ पे कैसे करते हैं?
So we have an occupational therapist who helps
अच्छा, who
them with
comes-
that,
okay.
and you stimulate them with light and
Okay.
color and long sessions that they need for that. So that happens here. Again, one of the few centers where we look after those children.